ಓಂ ಶ್ರೀ ಗುರು ಬಸವ ಲಿಂಗಾಯ ನಮಃ. ಶರಣು ಶರಣಾರ್ಥಿ. ಇಂದಿನ ವೆಲ್ಬೀಯಿಂಗ್ ಅಂಡ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ವರ್ಕ್ಶಾಪ್ ಆನ್ಲೈನ್ ಮೂಲಕ ಸೇರಿದ ಎಲ್ಲ ಶರಣು ಶರಣೆಯರಿಗೆ ಹಾಗೂ ಬಸವ ಭಕ್ತರಿಗೆ ನ್ಯೂಜಿಲೆಂಡ್ ಚಾಪ್ಟರ್ ಬಸವ ಸಮಿತಿ ವತಿಯಿಂದ ಹಾಗೂ ನನ್ನ ಕಡೆಯಿಂದ ಸ್ವಾಗತ ಸುಸ್ವಾಗತ. COVID has badly impacted wider communities on their daily life, well-being and mental health. So it's our responsibility to support our society, community and friends. ಸೊ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಹೋಗುವ ಮುನ್ನ ಒಂದು ಅಲ್ಲಮ ಪ್ರಭುದೇವರ ವಚನ ಹೇಳಿ ಆಮೇಲೆ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ. ಅನುಭವದಿಂದ ಹುಟ್ಟಿತು ಲಿಂಗ, ಅನುಭವದಿಂದ ಹುಟ್ಟಿತು ಜಂಗಮ, ಅನುಭವದಿಂದ ಹುಟ್ಟಿತು ಪ್ರಸಾದ, ಅನುಭವ ಅನುವಿನಲ್ಲಿ ಗುಹೇಶ್ವರ ಲಿಂಗ ಅನುಪಮ ಸುಖಿ. ಸೊ ಇಂದಿನ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಎಂದಿನಂತೆ ನಾನು 4 ಭಾಗದಲ್ಲಿ ಡಿವೈಡ್ ಮಾಡಿದ್ದೀನಿ. ಮೊದಲನೇದಾಗಿ ವಚನ ಗಾಯನ, ನಂತರ ಗೆಸ್ಟ್ ಸ್ಪೀಚ್ ಆನ್ ವೆಲ್ಬೀಯಿಂಗ್, ಮೈಂಡ್ಫುಲ್ನೆಸ್ ಅಂಡ್ ಬೆನಿಫಿಟ್ಸ್ ಇನ್ ಅವರ್ ಡೈಲಿ ಲೈಫ್ ಬೈ ಡಾಕ್ಟರ್ ಉಷಾ ಶೇಖರ್ ಅವರಿಂದ, ಹಾಗೂ ನೆಕ್ಸ್ಟ್ ಗೆಸ್ಟ್ ಸ್ಪೀಚ್ ಆನ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಬೈ ಡಾಕ್ಟರ್ ರಾಜೇಂದ್ರ ಪಾವಗಡ. ದೆನ್ 4ನೇ ಸೆಷನ್ ಅಲ್ಲಿ ಕ್ವಶನ್ ಆನ್ಸರ್ಗೆ ಓಪನ್ ಮಾಡ್ತೀವಿ. ಯಾರೆಲ್ಲಾದ್ರೂ ಏನು ಕ್ವಶನ್ ಇದ್ರೆ ಕೇಳಬಹುದು. ಅಂಡ್ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಹೋಗುವ ಮುನ್ನ ಕೆಲವು ಹೌಸ್ ಕೀಪಿಂಗ್ ಸೂಚನೆಗಳು. ದಯವಿಟ್ಟು ನಿಮ್ಮ ಮೈಕ್ರೋಫೋನ್ ಅನ್ನು ಮ್ಯೂಟ್ ನಲ್ಲಿ ಇಡಿ. ನಿಮ್ಮ ಟರ್ನ್ ಬಂದಾಗ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡು ನೀವು ಏನಾದ್ರು ಹೇಳೋದಿದ್ರೆ ಅಥವಾ ಕೇಳೋದಿದ್ರೆ ಅಥವಾ ಫ್ಲಾಗ್ ಮಾಡಿ. ಅಂಡ್ ಇಫ್ ಯು ವಾಂಟ್ ಟು ಟೆಕ್ಸ್ಟ್ ಎನಿ ಕಮೆಂಟ್ಸ್ ಆರ್ ಎನಿಥಿಂಗ್, ಯು ಜಸ್ಟ್ ಯೂಸ್ ಅವರ್ ಚಾಟ್ ಬಾಕ್ಸ್ ಸೊ ದಟ್ ನಾವು ರಿಪ್ಲೈ ಆದಷ್ಟು ಮಟ್ಟಿಗೆ ಮಾಡಕ್ ಪ್ರಯತ್ನ ಮಾಡ್ತೀವಿ. ಅದರ್ವೈಸ್ ಡಾಕ್ಟರ್ ಅವರಿಂದ ಎಲ್ಲ ಆನ್ಸರ್ಸ್ ನೀವು ಕೇಳಿಸಕ್ ಪ್ರಯತ್ನ ಮಾಡ್ತೀವಿ. And we will be recording this session and it becomes Basava Samiti Asia Pacific intellectual property, and it can be shared on Basava Samiti websites and social media if required, as required. ಈಗ ವಚನ ಗಾಯನ ಕುಮಾರಿ ಕ್ಷೇತ್ರ ನನ್ನ ಮಗಳು. ಸ್ಟಾರ್ಟ್ ವಿತ್ ಶರಣು ಶರಣಾರ್ಥಿ.
ನೀನಿ ಪಾಮರೆ ರೇ ಸಾನಿ ಸರಿ ಸರೇ ರೇ, ನೀನಿ ಪಾಮರೆ ರೇ ಸಾನಿ ಸರಿ ಸರೇ ರೇ, ನೀನಿ ಸಾ ಸ ಸರಿ ಪಾಮರೆ ಮರೆ ನಿಚ, ನೀನಿ ಸಾ ಸ ಸ ರೇ ಪಾಮರೆ ಮರೆ ನಿಚ, ಮಾ ಮಾ ಪಾಪ ನಿ ಪ ನೀನಿ ಸ ಸರೆ ನಿಸ, ಮಾ ಮಾ ಪಾಪ ನಿ ಪ ನೀನಿ ಸ ಸರೆ ನಿಸ, ni sari mare re sa sa ni sari sa ni pa ma pa, ni sari mare re sa sa ni sari sa ni pa ma pa, pare sa ni sa sa ni pa ma pa re ma re sa, pare sa ni sa sa ni pa ma pa re ma re sa, ni pa ma re sa, ni sari sare re, ni sa sa sare pa ma re ni sa ni sa 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 re pa ma re sa, ಚಲಬೇಕು ಶರಣಂಗೆ, ಚಲಬೇಕು ಶರಣಂಗೆ, ಚಲಬೇಕು ಶರಣಂಗೆ ಪರಧನ ನೋಲೆನೆಂಬ, ಚಲಬೇಕು ಶರಣಂಗೆ ಪರಸತಿ ನೋಲೆನೆಂಬ, ಚಲಬೇಕು 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 ಶರಣಂಗೆ, ಚಲಬೇಕು ಶರಣಂಗೆ, ಚಲಬೇಕು ಶರಣಂಗೆ ಪರದೈವಲನೆಂಬ, ಚಲಬೇಕು ಶರಣಂಗೆ ಲಿಂಗ ಜಂಗಮ ಒಂದೆಂಬ, ಚಲಬೇಕು ಶರಣಂಗೆ ಪ್ರಸಾದದಿತವೆಂಬ, ಚಲಬೇಕು ಶರಣಂಗೆ ಪ್ರಸಾದದಿತವೆಂಬ, ಛಲವಿಲ್ಲ ತವ್ರಮೇಚ ಕೂಡಲ ಸಂಗಮ ದೇವ, ಕೂಡಲ ಸಂಗಮ ದೇವ, ಕೂಡಲ ಸಂಗಮ ದೇವ, ಛಲಬೇಕು ಶರಣಂಗೆ, ಛಲಬೇಕು ಶರಣಂಗೆ, ಚಲಬೇಕು ಶರಣಂಗೆ ಪರಧನ ನೋಲೆನೆಂಬ, ಚಲಬೇಕು ಶರಣಂಗೆ ಪರಸತಿ ನೋಲೆನೆಂಬ, ಚಲಬೇಕು 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 ಚಲಬೇಕು. ಥ್ಯಾಂಕ್ ಯು.
ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ದೀನಿ. ಥ್ಯಾಂಕ್ ಯು. ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮ ಗೆಸ್ಟ್ ಸ್ಪೀಚ್ ಆನ್ ವೆಲ್ಬೀಯಿಂಗ್, ಮೈಂಡ್ಫುಲ್ನೆಸ್ ಅಂಡ್ ಬೆನಿಫಿಟ್ ಇನ್ ಅವರ್ ಡೈಲಿ ಲೈಫ್ ಬೈ ಅವರ್ ಓನ್ ಡಾಕ್ಟರ್ ಉಷಾ ಶೇಖರ್. ಇವ್ರ ಬಗ್ಗೆ ಹೇಳ್ಬೇಕಂದ್ರೆ ಇವರು MBBS DCH ಅಂಡ್ FRN CGP ಮಾಡಿದ್ದು. and she is very well-known doctor from our community. We are proud of that. And she is a general practitioner working in New Zealand for nearly almost 24 years or more than that. So over to you, Auntie.
Thank you, Sharon. ಶರಣು ಎಲ್ಲರಿಗೂ. ನನ್ನ ಹೆಸರು ಉಷಾ ಶೇಖರ್ ಅಂತ. ನಾನು ನಮ್ಮ ಹಸ್ಬೆಂಡು ಡಾಕ್ಟರ್ ರಾಜಶೇಖರ್ ನ್ಯೂಜಿಲ್ಯಾಂಡ್ ಅಲ್ಲಿ 27 years ಇಂದ ಇದ್ದೀವಿ, ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾ ಇದೀವಿ. ಲಿಟ್ಲ್ ಅಬೌಟ್ ಮೈ ಫ್ಯಾಮಿಲಿ. ಐ ಹ್ಯಾವ್ ಗಾಟ್ 2 kids. ನನ್ನ ಮಗ ಸೊಸೆ ಮೊಮ್ಮಗಳು ನ್ಯೂಜಿಲ್ಯಾಂಡ್ ಅಲ್ಲಿ ಇದ್ದಾರೆ. ಮಗಳು ಅಳಿಯ ಮತ್ತೆ ಪವಿತ್ರ ಮತ್ತೆ ಮೊಮ್ಮಗಳು ವಾಷಿಂಗ್ಟನ್ ಅಲ್ಲಿ ಇದ್ದಾರೆ. ನಾನು ಈಗ ಬಂದಿದ್ದೀನಿ, ಇಲ್ಲ ಇದ್ದೀನಿ ಸದ್ಯಕ್ಕೆ. ಈಗ ನಮ್ಮ ಅಣ್ಣ ಅರಿಜೋನಾ ಇಂದ, ತಮ್ಮ ಬೆಂಗಳೂರಿಂದ, ಮತ್ತೆ ನಮ್ಮ ಅಕ್ಕ ಅವ್ರ ಮನೆ ಬಾಸ್ಟನ್ ಇಂದ, ಅವರೆಲ್ಲರೂ ಲಾಗಿನ್ ಆಗಿದ್ದಾರೆ. ದಟ್ಸ್ ಗುಡ್ ಫಾರ್ ಮೀ ಅಂಡ್ ಥ್ಯಾಂಕ್ ಯು ಆಲ್ ಆಫ್ ಯು. ಅಂಡ್ ಡಾಕ್ಟರ್ Rajendra Pavagada, he's a well-known psychiatrist, and we are so grateful with his busy schedule of 10 hours per day. He has accepted to come and talk about mental wellness, and that's a great opportunity. ನಾನು ಕನ್ನಡ ಇಂಗ್ಲಿಷ್ ಎರಡು ಮಿಕ್ಸ್ ಮಾಡಿ ಮಾತಾಡ್ತೀನಿ, ಪರವಾಗಿಲ್ವಾ? ಎಲ್ಲರಿಗೂ ಅರ್ಥ ಆಗುತ್ತಲ್ಲ? ಓಕೆ. ಬಸವ ಸಮಿತಿ has requested to talk about mental well-being and mindfulness program. Addressing mental wellness and mindfulness program is more necessary now than any other times because of the COVID has thrown a lot of challenges to us, and also the daily challenges in our life. Mindfulness, in simple terms, means appreciation and understanding of the present moment. ಇವಾಗ ನಾವು ಏನು ಮಾಡ್ತಿದ್ದೀವಿ, ಹೇಗೆ ಮಾಡ್ತಿದ್ದೀವಿ ಅಂತ. This mindfulness program is nothing new to Hinduism and Buddhism. It has been there since we know these religions for a long time. But this was introduced to the mainstream medicine by a professor Professor Dr. John Corbett-Zinn in late 1970s in Massachusetts University. Since then, a lot of research work has taken place, and it has proved how mindfulness helps in every field of life. Let me start by stating a word called our brains are neuroplastic. It's a complicated word. The neuroplastic means, in simple words, our brains are constantly changing and shaped by what we experience in our everyday life, wittingly or unwittingly. Most time, I would like to categorize firstly what challenges we face. ಏನೇನ್ ಚಾಲೆಂಜ್ ಇದೆ ನಮ್ಗೆ ಲೈಫಲ್ಲಿ, ಅದನ್ನ 4 category ಮಾಡ್ಬೋದು. First thing is it is called distractibility, that is getting easily distracted. Second one is loneliness. The third is negative self-talk. The fourth is loss of purpose in life. Let me just expand it. Onandanu expand ಮಾಡ್ತೀನಿ. Distractibility andre easily getting distracted. It is very interesting. There was a research from Harvard University which shows that the average human being spends 47% of his life not paying attention to what he's doing. This is almost 50% of our life. This was a research done. When we are not paying attention, that means our mind is wandering. Wandering brain is not a happy mind. So when we are not happy, it leads to all sorts of issues like anxiety, lack of productivity, lack of focus, not reaching the full potential. So all that stems from that. And there has been evidence that there has been an increase in the condition called attention deficit disorder in children. It's called ADHD. That can have lot of other reasons, but distractibility is one of the other reasons. The second thing I'm talking about is loneliness. It is very contradicting to say loneliness in this present world of social media. We all are more connected through our WhatsApp, Facebook, social media platforms. Yet 70% of the people say at some stage they are feeling lonely. Loneliness itself, it doesn't stop there. Loneliness leads to physical ill health, which leads to mental ill health. And there has been evidence to show that that 60 people, I'll just have a look at it. There is some percentage about it. The physical health and mental. Recent research, in fact, shows that loneliness is actually more of a predictor of early death than obesity. The third thing we are talking about is negative talk, self-talk. And most of the people, it is about how we understand we are. Navu enu anta understand ಮಾಡ್ಕೊಂಡಿರ್ತಾರೆ. Most of the time we have negative talks about ourselves. For example, oh, I should lose weight, I'm fat, I'm tall, I should do more, I should not sleep more. So these are the negative thoughts will become beliefs. And these beliefs causes what we call as shame. When there is a shame, you want to avoid situations. When we avoid situations, we start feeling the same of anxiety and depressions and other things. It has been shown that there has been an increase recently of depression, excessively, mainly in women and teenagers. There has been a significant increase in suicidality in adults and teens as well. The third thing we are talking about is the loss of sense of purpose in life. Most of the people interviewed, they say they have no meaning or purpose in life. When they have no meaning or purpose in life, this leads to impacting their physical health and the mental health. And it has shown that people, significant number of people above 60 years who had no purpose in life or significant meaning in life, they, compared to other people who had purpose in life, their lifespan was significantly reduced because of the physical and the mental health. So these are the main challenges we are facing. See, each of these affects our mind and our brain, and this is in turn affects our physical and mental health. It's important we take responsibility for our own brain, which can transform our minds. The transforming our mind, and for a healthy mind, we can put it under a framework of 4 pillars, which I would say awareness, connection, insight, and purpose. Awareness, what is awareness? Awareness means the capacity to focus our attention and resist distraction. That is awareness. That's all. This includes a quality that neuroscientists call is meta-awareness. Meta-awareness is a medical word. It is in a simple word, it means knowing what your mind is doing at this point of time. I'll give you an example. You're seeing a computer, you're reading some pages. Sometimes you're reading your book. You have read first page, second page, then you think back, you can't remember a thing. This can happen to a lot of us. It happens to me also. This is called lapse of meta-awareness. The moment we realize this and come back, that is meta-awareness. It's a simple thing. We all do. And also we talk about insight. We talked about self-talking, negative self-talking, which can lead to all types of mental and physical problems. And also the purpose. Purpose is having something to do in life. Having a purpose in life is very important. How we can improve this is by connection refers to the qualities that nurture hormonal relationships like compassion, kindness, caring, and having a positive outlook. Research shows that it doesn't take much to change these things in the brain by constant practice of mindfulness. That is important. This can be changed. And people with negative talk and lack of purpose, by doing these regular practices, they have found it can change their attitude towards life. Sometimes doing some simple pleasurable activities like gardening, reading a newspaper, going out for a walk, all these things can have impact on our loneliness and purpose. Neuroscience research, so the scientists have shown that the wiring in our brains is not fixed, it is adaptable. Before they used to think once you're 2-year-old, your brains can never change. But the research here has recently, a lot of research has been shown that the wirings can be changed, the circuits can be changed by constant practice. For example, I'll give you an example where there was a study between two groups of people where it's only for 2 weeks they did. One group of people received few hours of meditation a day for 2 weeks. The other group received cognitive behavioral therapy, which is a mainstream treatment. They did an MRI scan before and after the scans, and there was significant changes. The part of the brain which helps with the positive emotions, the wiring and the circuit were more strengthened there. So this has been proved. So this is very important. This is called neuroplasticity, we call it as. So, the other thing I would like to give an example. I think we'll go for what is mindfulness. I'm talked about mindfulness practice and everything. What is mindfulness? That's a question. Mindfulness is a very basic human ability to be fully present, aware of where we are and what we are doing. It is that moment. It's very important. And not be overly reactive or overwhelmed by things around us. It is appreciating and understanding the present moment. That is mindfulness. And it is a learned behavior. I was listening to one of the talks by the founder of mindfulness, Dr. John Corbett-Jim. What he was telling was, cavemen didn't brush their teeth. So we started brushing our teeth. We just do it. We don't think about it. So it is a learned behavior. So mindful training can be a learned behavior. He also gives a very good metaphor in which he says, the famous and the best musicians in the world tune their instruments before they do any performance. Nobody does performance without tuning their instruments. So it's really important to tune our brains to improve the quality of life and also as a society as such. Yoga is a form of mindfulness practice which emphasizes on unification of mind, body, and soul. Here are what is mindfulness exercises? I'll go into mindful exercises. Nandy internet cut off with though. So I had to log in again.
Okay. Cool.
So I was talking about mindfulness practices. What is mindfulness practices? Mindfulness practices can be taken informally and formally as well. What is informal? For informal mindfulness practice, you don't have to take out your time in a day to do that. You can do it while walking, by doing your regular duties, or driving, anything. For example, how you do mindfulness walking, you may ask. It's just when you're walking, look around you. What is there around you? The colors around you, what senses you feel, what other things are there. Appreciating all the things at that moment is important. You get distracted easily, but you can always come back and appreciate that. So while doing at work, sometimes just giving 2 minutes of yourself, having a mindful breathing relaxes you a lot. That it is proved that's quite good as well. The third thing is we are talking about mindful eating. What is mindful eating, you say? What they say is mindful eating helps us in a lot of ways. First of all, like you have to put your devices off. When your food in front of us, first thing I would like to say is you're feeding not only your body, you're feeding your soul when you're eating your food. And it also the appreciation, looking at the color, the texture, and feeling the food going into the body. All that helps us, they have found. How it can help mindful eating is, first of all, it increases our focus, attention, and it helps to reduce the stress hormone called cortisol in our body. And it gives us the awareness of when we are full and when we are hungry. And it helps our indigestion. So even this is a mindful practice. So if you come to formal mindfulness practice, it's like mindfulness breathing, mindfulness meditation. We can incorporate yoga also into this formal mindfulness practice. And there are also what people call as body scan. I think the body scan most is like our yoga nidra, what we do in our yoga. So how do you do the mindfulness breathing? Most of you know about it back from India, but still, I'd like to talk a few things about it. Mindfulness breathing is if you sit in a calm place, relaxed in chairs or on the floor, closing your eyes or half closed initially, trying to feel the air going through your nostril to the throat, to the chest and to the abdomen. Feel that your abdomen belly is coming front. Then exhaling slowly in the reverse way from the belly, moving the air, feeling the air going from your belly to the chest, to the throat and through the nostrils. This one, when we are doing this, it's easy to get distracted. What they say is if you get distracted, it's okay. Be kind on your mind. You can always come back. Don't get upset. Oh, I can't do this. You get distracted. Everybody gets it. The work of mind is thinking. So like heart is working always, mind is thinking always. So always you get distracted, you can always come back. This amount of distractibility gets better and better as we constantly do our meditations and breathing exercises. Normally, like keeping 3 minutes a day in the morning, it's better. It's all you need, 3 minutes, 5 minutes, depending on how busy you are, how you can fit into your daily life, that's important. So that is very important. The other thing is, the body scan I was talking, it is like our yoga nidra, what I understand. I mean, Dr. Rajendra can comment if anything I need to add or take out from it. Lying in a lying position, you try to first feel your body from the leg to the arms to the head, feel all the senses, slowly relax each part of the body and concentrate on breathing. So these are the other ways of doing mindfulness practice. These practices should be consistent for the changes to take place. Doing for 1 day and 2 days and stopping it may not find any changes. It's like regular practice. Like how many days is possible for unification? That is important to know the changes. So this mindfulness practice has got several advantages. I'm going through that because it's the benefits of this mindfulness practice are that when we are mindful, we reduce stress, enhance performance, gain insight and awareness through observing our own mind, increase our attention to others' well-being, cultivate a strong sense of purpose, reduce distractions, and increase productivity and focus. And lot of companies all over the world nowadays, they are taking their employees, giving their employees this mindfulness course and they have found that even from Google, I've heard, increases the productivity of the people and what it happens. Finally, I would like to end with a short mindfulness practice to give you a small taste of this practice, though most of you know it better. If you can all sit for a few minutes in a comfortable position, let us have a small practice of mindfulness breathing. Can you all sit put all your devices down. Try to sit in a relaxed position, whether it's on the chair or on the floor. Try to close your eyes or half open. Keep your hands relaxed on your knees. Try to keep your back straight and relax your shoulders. And we'll start with chanting Om 3 times. So we can all do it together. Om. Now we start focusing on your breath. Feel the air at the nostril. Feel it going slowly towards your throat and to your chest and to the belly. That is called diaphragmatic breathing. Your belly should come front when you're taking inhalation. You pause for a moment. Slowly exhale, starting from the belly, through the chest, throat, and through the nostrils. You can do it another 2 or 3 times. Okay. So practicing any of these daily in your life, either informally or formally. There's a lot to talk about mindfulness course, how it, they say deep breathing causes delta waves, which is the deep sleep phase. So it's too technological. So I thought I'll keep it simple. So hopefully this mindfulness is of some help to you. I'm grateful for it.
Thank you.
ತುಂಬಾ ಥ್ಯಾಂಕ್ ಯು ಡಾಕ್ಟರ್ ಆಂಟಿ. ಮೈಂಡ್ಫುಲ್ನೆಸ್ ಬಗ್ಗೆ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇಳ್ಕೊಟ್ಟಿದ್ರಿ. ಯು ಲಿಂಕ್ ಮೈಂಡ್ಫುಲ್ನೆಸ್ daily life to scientific reasons as well as yoga and research aspects approaches. That was quite helpful. And ಆರೋಗ್ಯ ಮತ್ತು ಯೋಗಕ್ಷೇಮದ ಬಗ್ಗೆ ತುಂಬಾ ವಿವರವಾಗಿ ಹೇಳ್ಕೊಟ್ರಿ. And loneliness and how negative thoughts overcome our life. That was a good part. And significance of life, mindfulness, exercise, and so on, so on. It was really helpful.
Thank you so much.
Thank you very much. Thank you.
Sharan. Okay.
Okay, ಈಗ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮ ಗೆಸ್ಟ್ ಸ್ಪೀಚ್ ಆನ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಬೈ ಡಾಕ್ಟರ್ ರಾಜೇಂದ್ರ ಪಾವಗಡ. Rajendra Pavagada sir is well-known psychiatrist Manovaidyaru from again our community and currently working at Middlemore Hospital, Auckland. And he's working almost like more than 20-25 years in this region. So over to you, sir.
Oh, good evening. Good afternoon. Thanks. Ellargu namaskara. Those who don't know, my name is Rajendra, and basically I'm from Davangere, and I'm here in New Zealand since '96. Before I start, I think I should really thank Dr. Usha Shekar for her wonderful presentation on mindfulness, which is very important for everybody's mental health. Also, I need to apologize to Dr. Usha Shekar and also to Lina Kalburgi because I never responded to their messages or never attended their calls. This is mainly because many of my colleagues have become unwell because of COVID. So we have to step in and help our colleagues, so I couldn't do that. My apologies. There was no other reason why I didn't return your call, but I spoke to Lena in the morning, and I think my wife Kaberi, she had an hour talk with Lena this morning. So I keep wondering what they were talking. So
I think she compensated your talk.
yes, namaskara, sir.
Namaskara,
Hegiddira?
namaskara. Nice to see you, doctor.
Nice to see you. Yeah.
Mm.
Unfortunately, I mean, because of various reasons, none of us can meet. And hopefully, this will get over soon, and we can meet again.
Soon.
And
Yeah.
especially, I miss Lena's food. So
I miss Kaveri's talk, so
I know. So
we'll meet
nobody
soon.
misses Dr. Kalburgi. So
Yes.
What? Kalburgi is what? Dash.
Dash. Thank you.
This will be very informal. I mean,
Yeah.
talk
It
on
is
mental
informal.
health.
It's like like-minded jana navala
Yes.
kutkontidevi. So get
Yeah.
to know more about our health and well-being. So please go more of the casual. So that's the approach we would like to have.
Yep. No, that's fine. Thank you. So, I mean, before we start, I think the first thing is we all need to know what is health. So, health doesn't mean that it is just an absence of disease. It is being a complete physical, mental, and social well-being. That is the definition of health. So, and among the health, I mean, there is physical health, mental health, social health, occupational health, and different health. So, mental health is how we think and feel about ourselves. Like whether I feel good about myself or good about others, how confident I am. And also it applies to others, what I think of others. And suppose if something happens, how I interpret that event. That is, if something bad or good happens, how do I interpret? Mental health also helps us to learn our capacity to learn new things, communicate with people, talk to people, and develop relationship and sustain relationship. It influences our ability to cope with change. Like suppose if you get married or if you get a child or if one of your family member pass away. So how do you cope with that change? How do you cope with your transition? Like suppose you get promoted or you change your job or move to a city. How do you cope with those life events and transition? They are very important. And recently, the mental health has become more important because of COVID pandemic, especially since 2020, because it has affected almost 93% of our countries in the world. And I don't think there is anybody who is left who has not been affected by COVID one way or the other. So next is, what is mental illness? So mental illness is a condition where your emotions are changed, your thinking or behavior is changed, and that causes a problem to you or to your family or in your social or occupational functioning. Mental health is one of the commonest disorders, but unfortunately, this is the one which has been most neglected. Suppose if we take the top 6 disorders in the world which affects either the death rate or which causes the financial problems, 4 of them are mental health problems, apart from diabetes and a heart attack, like depression, schizophrenia, bipolar disorder. 1 in 5 people in New Zealand suffer from mental health problems, and 1 in 5 people are on medication for mental health problems. It affects about, in New Zealand, it costs about $2 billion per year about mental health because of the mental health problems. And mental health problems is, at a given time, there are 450 million people in the world are suffering from the mental health problems. And nearly 1 million of them commit suicide every year. And if you take any families, like 1 in 4 families are affected by the mental health problems. And it impacts not only the individual, the family, and society very significantly. Cost is not only the financial, it is also social costs. And also, because of the mental health problems, people experience human rights violations, stigma, and discrimination. The most 4 common mental health problems are depression is the most common cause in the world. It is more common in women when compared to men. There is no exact reason why it's more common in women, but if you take the percentage wise, it's about 60% women, 40% men. One of the explanation is men will have different other disorders. When somebody suffers from depression, they experience low mood, they feel depressed, they lose motivation or interest in doing things, they have thoughts of ending their life, some of them eventually committing suicide. They're not able to sleep, they're not able to work, and also they lose their energy. Next common psychiatric mental health problem is the anxiety. Anxiety is a kind of, we all feel fearful. Like we feel fearful because we experience a fearful event. Whereas in anxiety is you feel fearful without any reason. And when you feel fearful, you feel that there's something bad is going to happen, and because your heart rate beating fast. And these are the people, like, they end up in hospital in the ED thinking that emergency ward, thinking that they have a heart attack. And there are different forms of anxiety. People feel anxiety if they want to, like social anxiety, the meeting people, strangers, or it can be because of fear of height or fear of snake, or it can be fear of death. The third other common cause, a common mental health problem is the bipolar disorder. That is where a person experiences periods of low mood or high mood. Low mood is similar to what depression I spoke before, whereas high mood is called hypomania or mania, where somebody feels excessively happy for no reason, very distractible, very impulsive, spends a lot of money, thinks that they are Superman, and most of them end up causing damage to themselves or to the society. The fourth common mental health problem is schizophrenia. That is, it is a very severe form of mental health problem. Fortunately, this is not very common. It's about, at given time, 1% of the population suffer from that. And every year, like 1 in 1,000 develop schizophrenia. Here, they lose touch with reality. They believe that somebody is against them, somebody trying to harm them. Some people experience like hearing voices, they hear things. Some people think that they are being in touch with aliens or somebody conspiracy theories. They believe in that. And fortunately, all of this, most of the psychiatric disorders are treatable. The one thing which is important in treating psychiatric problems is getting help early. More you get help early, more you recover. Actually, recovery rate for mental health problems is quite good, even when compared to like a condition, diabetes or a blood pressure, where you have to take medication for the rest of your life. But most of the psychiatric problems you can treat with, and you don't have to be medication for the rest of your life. But we are all immigrants, and being an immigrant, we carry a extra risk of having mental health problems. I mean, we have come to New Zealand for various reasons. And when we come to New Zealand, we live beyond our family and friends. And there's a very significant problem. For few of us, too very fortunate to meet people like Dr. Kalburgi, Lina, and one more, Professor Vamnamurthy. I mean, and also we had quite good friends. They were very kind and their support, and it was like it is like a family outside New Zealand for us even now. I mean, but many people are not that fortunate. Some people don't get enough social supports, which causes the problem. Other problem for the immigrants is the guilt. Suppose, especially those who come from India, like we all grown up in a joint family, like suppose if there's only one child or a two child, you leave your parents and come here, and you every day you worry about your parents, you feel guilty about leaving them there. Third is, fortunately for us from India, English is not a problem, but again, for other communities, language difficulties, but also the lack of knowledge of what sources are available in a new country. I mean, these are all the reasons. Most common other reason is loss of social status, especially when you are at a certain particular level in the community where you are coming from. But when you come to a new country, usually you go down or you start from the beginning. So your social status is lost. And also it can be loss of income in the initial stages. But these are the various reasons why the immigrants are more at a risk of developing mental health problems. But and it is depression and anxiety is the most common cause for that, especially for those with second generation have got a different problem. That is, those our children who are born here or when they come here are very young. They have a different problem because they find it difficult in fitting into two different societies. When they go to school or when they go to work, they have to be fitting into the local society. When they come home, they have to conform with our tradition and culture. I mean, some of these people can be very difficult and it will be very confusing for them. So, I mean, these are the reasons why the mental health problems is more common in immigrants. And coming is about the COVID. We all know that it started in 2019 around September, now October in China and spread all over the world. 93% of the countries in the world have reported COVID patients. There are few who are not reported. And it is a pandemic which is affected not only health and well-being globally, not only the physical health, it affected our economic, loss of finance, social implications, but also has a very significant psychological impact. Actually, when the COVID started in the beginning, I think everybody was very fearful of COVID and very anxious, especially if somebody develops COVID or somebody whom you know that he had developed COVID. They were discriminated, they were stigmatized, no fault of their own, like any one of us can develop COVID. The major problem in the beginning was there is no treatment, definite treatment, and also there was no vaccine. And even though now the vaccine is there, probably all of us had 3 doses, but still we are not 100% protected. The COVID led to a lot of unemployment, and also other thing which really affected COVID was the lockdown. When first lockdown happened, it was very novel for many people. Many people enjoyed, but as the second time it happened, I know many people suffered. They had a lot of what is called the lockdown fatigue. Whereas some of us have to, even in lockdown, we continue to work, but again, working from home has been quite difficult for many people because many people lost job. there is a loss of income. Because of the lockdown, one of the most significant thing happened to all of us was we are unable to share our sorrow or joy. Like we couldn't meet anybody. Suppose if you had a child in the house, you couldn't share it with your family and friends. If you had a death in the family, I know there are many of my friends, even they couldn't go to attend the funeral. The hospital did the funeral. These are the initial stages. I mean, it was very traumatic for many people. And because of working from home also caused a lot of relationship difficulties, because both husband and wife and children all are at home, sometimes in a very confined space, both of them working. This caused increased domestic abuse, relationship difficulties. And other thing was we couldn't travel and we were all stuck at home. Like for me, it's go to work, come back. That's it, nothing else I can do. There was no, I can go and meet somebody or go and have a lunch or go and have a drink with someone. The third thing which COVID caused the problem was a lot of myths about spread, a lot of misinformation, a lot of conspiracy theories. I mean, though most of us are well educated enough to know the difference, but it did affect a significant number of people, and even it's still affecting a significant number of people. And the main cause, because of the COVID, many people develop depression, anxiety, what's called the obsessive compulsive disorder, where they started washing their hands excessively because they think that they had to do that. I know a few people where they used to undress in garage as soon as they go to the car, get down, wash the clothes, have a shower, and then enter the house. So, I mean, these were not necessary, but again, because of the fear and it caused a lot of problem. And most of, I won't be surprised if some of you had this problem. During the lockdown and initial lockdown, the bad dreams or the nightmares were the worst. Almost like 1 in 5 people had bad dreams. It was very common, but most people didn't know initially why they were experiencing bad dreams. I mean, you don't have any other problems, but you still had this. So, hopefully, cross fingers. I think the Omicron is the last variant we see, and hopefully we will be able to travel, we'll be able to meet, and hopefully this COVID will be get over. I mean, these are the problems. Like what we can do to improve our mental health. I mean, it is because having a good mental health is fundamental for physical, social, occupational well-being. I mean, it's important. And as Dr. Usha Shekar said, that mindfulness and meditation is one of the very important things which helps in keeping us all healthy in terms of the mental health. Other thing is, which is very difficult and among our Indian societies, talk about our feelings. We don't talk about our feelings because we think that if we talk about our feelings, that we are weak or we are inferior. It is especially more common in Indian men than women, but again, it is more common in Indian population when compared to other ethnicities. Probably it's more common in the Eastern, like the Asian population, other Asian population. So talking about your thoughts, feelings, being honest about how you feel, talking to somebody who's close to you will definitely help. Other thing which is, one thing which is important, you had to have a good mental health is exercise. Exercise, it doesn't have to mean that you have to go to a gym or you have to do heavy exercise. Even walking 30 minutes a day, running, any form of playing a sports, 20 to 30 minutes will definitely help. Sometimes it is as good as an antidepressant, especially in the mild form of depression. Third thing is eat well, sleep well, have 6 to 8 hours of sleep. If you are drinking alcohol, it is nothing wrong in that, but drink sensibly, don't drink too much. Keep in touch with the family, keep in touch with your friends. That's very important. And one thing which is, we are all good at something. We are all not, I mean, not all of us are good at everything, but again, we are good at something, which is what you are good at it, keep doing that. That will help you. And never compare yourself to others, accept who you are, because all of us are different, all of us are unique, all of our situations are unique. Never ever compare to yourself with others. Other thing is care for others, care for your friends, care for your family. Friends are really important. We help each other whenever we can. It is always, friends are always a two-way street, like supporting others always uplifts you. And third, the next is to take a break. Whatever you do, take a rest. Don't do too much of work. Always have a time for yourself. Always where you either you read or you exercise or you listen to music or watch a TV, do that. And next important thing is, very important, is when need, ask for help. There is nothing wrong in asking for help. And again, asking for help is very difficult with our Indian community, so, because they don't ask for help. They think that, especially with mental health, if you ask for help, you're weak. No, you're not. Because I mean, this is, I was trying to read about, like about 20, 25 years back when I was in before 96, when I was in Mysore, I did an article on vachanas and mental health. Unfortunately, I mean, I tried searching this whole day. I couldn't get it. I mean, all of you are probably more aware than me about Vachana Sahitya. I mean, there are more than 21,000 Vachanas based on Basaveshwara philosophy. I mean, especially, I think, if I remember correctly, I think Allama Prabhu and Akkama Devi, I think they spoke about how to keep mental health. Even Basaveshwara did that. Like, especially the way you lead your life is important. Like, one of these vachanas is Kalabeda, Kulabeda, Usia Nudia Beda, under Tanna Bandisa Beda, under and Alia Beda. Like, I mean, it is a vachana which says what one should lead a healthy life. I mean, these are the people like in 12th century, 13th century spoke about that. And unfortunately, we are not practicing, or those things were lost. But again, people are becoming aware of it, and those are the things which helps. Because of these vachanas, they never made a distinction based on the caste, sex, or the social status. They treated animals and trees equally to humans. Especially the current situation where, because of the COVID and what's happening around the world, I think these Vachana Sahitya is very relevant nowadays. So thank you. So hope this was helpful. And any questions, please.
Tomba, thank you, sir. You gave very good insights about mental health, and you started with health definition, physical, mental health, and well-being. And you linked these to change transition, anxiety, depression, and top 6 disorders are related to mental health. Also mentioned about immigrants and their social life challenges in new place. That was really awesome. And the effects of COVID and lockdown, work from home difficulties. Yes, we faced all these things and we experienced. Lastly, you mentioned about importance of mental health and importance of friends and families. Also touched on Vachana Sahitya and it's important in daily life. That was a highlight. Thank you very much for giving all these insights. Thank you. Now I open for any question and answer. So anybody has any questions, please go ahead.
Rajendra ಅವರೇ, ನಾನು wanted to ask you about some sound is coming up. ಕೇಳಿಸ್ತಿದ್ಯಾ?
Yes, sir.
The depression we get in COVID people,
Yep.
Is it multifactorial? Like, is it because of financial restrictions, separation anxiety, or is the virus responsible for some structural neurohormonal changes causes the depression? What is
Yeah, I mean, because the virus is here only for about 2.5 years, especially for the mental health, we need a little longer time to know the effects. What has been recently seen is especially the problems with cognitive problems, forgetfulness has been shown because of structural changes in the brain. There is no recent research telling that depression is because of any structural change. But again, I think depression is because of social isolation. Yeah, social isolation, stigma, and other things. But definitely there is evidence to say that virus is causing cognitive problems, that with memory and attention, which has been quite significant for people. And other common symptoms they're experiencing is fatigue and tiredness.
very tiredness?
Yeah,
is this depression comes a depression, no? What time of the COVID framework is it early, late, or anything like
most
that?
of them are post depression, post COVID, especially like yeah, like in the beginning it was like as if like if you develop COVID you're going to die. That was the thoughts of many people, though everybody said that it is not like that. But again, sometimes many of these people developed the COVID, especially people from India. Like, I mean, I got many people from Punjab who developed COVID the first time. They all thought that they are going to die, and they developed a significant depression because what could have happened to me? Like the same thing, like you may see in those people who has heart attack and survive. After they survive, they feel very depressed because, oh, I could have died at that time.
And the treatment response is good for the
treatment response is fortunately good. Yes. Yep.
Thank you so much, Dr. Rajendra.
No problem.
Dr. Usha, Usha ಅವ್ರಿಗೆ ಒಂದು ಕ್ವಶನ್, ಸಿಂಪಲ್ ಕ್ವಶನ್. ನಾನು ಮೆಡಿಟೇಷನ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತೀನಿ, ಒಂದ್ 3-4 ಮಿನಿಟ್ಸ್ಗೆಲ್ಲ ನಿದ್ರೆ ಬಂದ್ಬಿಡುತ್ತೆ ಯಾವಾಗ್ಲೂನು. ಯಾಕೆ ಅಂತ?
ಅದು ನಿನ್ನೆ when I was looking into one of the talks, I said that somebody was telling ನಾನು ಬಂದ ತಕ್ಷಣ ನಿದ್ದೆ ಮಾಡ್ಬಿಡ್ತೀನಿ, ಯಾಕೆ ಅಂತ ಕೇಳ್ತಿದ್ರು. ಅದಕ್ಕೆ ಅವರು ಡಿಫರೆಂಟ್ ರೀಸನ್ಸ್ ಹೇಳ್ಸಿದ್ರು. ಒನ್ ಥಿಂಗ್, ಫಸ್ಟ್ ಯು ಶುಡ್ ಚೆಕ್ ಯು ಆರ್ ನಾಟ್ ಸ್ಲೀಪ್ ಡಿಪ್ರೈವ್ಡ್ ಅಂತ. ಆರ್ ಯು ಸ್ಲೀಪಿಂಗ್ ವೆಲ್ ಅಂತ ಹೇಳಿದ್ರು. ಬಟ್ ದ ಸೆಕೆಂಡ್ ಥಿಂಗ್ ಇಸ್, ಇಫ್ ಯು ಫೀಲ್ ಸ್ಲೀಪ್, ಬಟ್ ಫಾರ್ ಮೆಡಿಟೇಷನ್ ಯು ಶುಡ್ ಬಿ ಅವೇಕ್ ಅಂಡ್ ಅವೇರ್ ಅಲ್ವಾ? ಸೊ ಸ್ಲೀಪ್ ಇಸ್ ಕಾಂಟ್ರಾಡಿಕ್ಟರಿ ಅದಕ್ಕೆ. ಸೊ ವಾಟ್ ಹಿ ವಾಸ್ ಸಜೆಸ್ಟಿಂಗ್ ವಾಸ್, try to do something to keep yourself awake. The last resort is don't take a cold shower on the I mean, if you want to be aware and awake and get full impact of meditation, see that you're not sleep deprived, do something to wake you up. Then, you know, these are methods you have to try. This is what Dr. John Corbett was telling. I don't know much about it, but these are the two suggestions they had to. Yeah.
Thank you.
Good. ಇದು ನಾನೊಂದು ಡಾಕ್ಟರ್ ರಾಜೇಂದ್ರ ಅವ್ರು ಕೇಳ್ತಾ ಇದ್ದೇನೆ. ಈಗ ಯಾರಾದ್ರೂ ಡಿಪ್ರೆಷನ್ಗೆ ಸ್ಥಿತಿಯಲ್ಲಿ ಇದ್ದಾಗ, ಹೌ ಡು ದೇ ನೋ ದಟ್ ದೇ ಆರ್ ಅಂಡರ್ ಡಿಪ್ರೆಷನ್?
One is they don't have any interest. They don't eat. They don't sleep well. They become socially isolated. Most of the times, it is sometimes the family members notices better than the patient itself. And sometimes the people have thoughts of harming them, suicidal thoughts, which is common. So these are the things which makes them to notice that they are depressed. And again, they cry for no reason, suddenly become tearful, like ಚಿಕ್ಕಾರಣ ಕೊಡೋದು. They lose appetite, they lose weight.
Okay.
ಡಾಕ್ಟರ್ ಉಷಾ
So,
ಅವ್ರಿಗೆ ಒಂದೆರಡು ಕ್ವಶನ್ ನನ್ನಿಂದ.
okay.
ಏನಂದ್ರೆ ಇದು ಮೈಂಡ್ಫುಲ್ನೆಸ್ ಇಸ್ ಇಟ್ ಅವೇರ್ನೆಸ್ ಅಂತ ಹೇಳಿದ್ರಿ. ಅವೇರ್ನೆಸ್ ಕನ್ನಡದಲ್ಲಿ ಅರಿವು ಅಂತ.
ಅರಿವು ಮೈಂಡ್ಫುಲ್ನೆಸ್ಗೆ ಇದು ಹೇಳಿದ್ದು ಸಾವಧಾನತೆ ಅಂತ ಒಂದಿತ್ತು, ಅರ್ಥ ಹುಡುಕ್ತೆ ಕನ್ನಡದಲ್ಲಿ.
ಸಾವಧಾನತೆ ಅಂದ್ರೆ ಇದೆ ಸ್ಲೋ
ಸ್ಲೋಯಿಂಗ್ ಅವರ್ ಸೆಲ್ಸ್ ಅಟ್ ದ ಸೇಮ್ ಟೈಮ್. ನೀವು ಅವೇರ್ನೆಸ್ ಅಂದ್ರೆ ಅರಿವು ಅಂತಾರಲ್ಲ, ಈ ಮೊಮೆಂಟ್, ಈ ಪ್ರೆಸೆಂಟ್ ಮೊಮೆಂಟ್ ಅಲ್ಲಿ ಏನ್ ಮಾಡ್ತಿದೀವಿ ಅದರ ಅರಿವಿರಬೇಕು.
ಓಕೆ ಓಕೆ. ಬಟ್ ಅದರ್ವೈಸ್ ಅರಿವು ಅಂತಂದ್ರೆ ಅದು ವೆರಿ ಇದು ಬ್ರಾಡ್.
ಅರಿವು ಅಬೌಟ್ ದ ಪ್ರೆಸೆಂಟ್, appreciating and understanding the present.
ಓಕೆ, ಅಂಡರ್ಸ್ಟುಡ್. ಓಕೆ, ಮತ್ತೊಂದು ಇದು ಹೇಳಿದ್ರಿ ನೀವು, ಏನಂದ್ರೆ ಮೈಂಡ್ಫುಲ್ನೆಸ್ ವೈಲ್ ಈಟಿಂಗ್. ನಾವು ತಿನ್ನುವಾಗ ಮೈಂಡ್ಫುಲ್ನೆಸ್ ಇದ್ರೆ ಅದು ಊಟದ ಇದು ನಮ್ಮ ಮೈಂಡಿಗೆ ಹೋಗುತ್ತೆ, ಸೋಲಿಗೆ ಹೋಗುತ್ತೆ ಅಂತ. ಈಗ ಮಾಡರ್ನ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಏನಂದ್ರೆ ತುಂಬಾ ಬಿಜಿ ಇದ್ದೀವಿ ನಾವೆಲ್ಲ. ವಿ ಡೋಂಟ್ ಹ್ಯಾವ್ ಟೈಮ್ ಟು ಸಿಟ್ ಕ್ವೈಟ್ ಅಂಡ್ ಈಟ್. ಮೋಸ್ಟ್ ಆಫ್ ದ ಪೀಪಲ್ ಏನಂದ್ರೆ ಊಟ ಮಾಡುವಾಗ ಟಿವಿ ಆನ್ ಮಾಡ್ಕೊಂಡು ಊಟ ಮಾಡ್ತಾರೆ.
Yeah, that's what mindfulness eating is. You have a place to eat with no devices anta.
Oh, I see.
With no devices and so
ಅದನ್ನ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ಬೇಕು ನಾವು. ಆಕ್ಚುಲಿ ಏನಂದ್ರೆ ಅಂದ್ರೆ ಊಟ ಮಾಡುವಾಗ ಟಿವಿ ಕಡೆ ಹೋಗ್ಬಾರ್ದು. ಊಟದ ಒಂದು ಮೊಬೈಲ್
and
using the senses to the food.
How okay, but the children again, unless you give the device, they won't eat food. So wherever, even in the hotel you see, at home you see, it just devices become a necessary thing for them to feed. So
sometimes we have to gradually change them.
Yes. The important way to guide adults.
If all the adults sit with the kids at the same time, sometimes that may happen, Anta. That's what I think. Yeah.
ಡಾಕ್ಟರ್ ರಾಜೇಂದ್ರ ಅವರಿಗೆ ಒಂದೆರಡು ಕ್ವಶನ್. ಏನಂದ್ರೆ ನನ್ನ ಅನಿಸಿದ ಪ್ರಕಾರ ಎವ್ರಿ ಒನ್ ಈಸ್ ಹ್ಯಾವಿಂಗ್ ಎ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಪ್ರಾಬ್ಲಮ್. ಅಂತ ಪ್ರಾಬ್ಲಮ್ ಅಲ್ಲ, ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಇಶ್ಯೂ. ಮೇ ಬಿ ಡಿಫರೆಂಟ್ ಪರ್ಸೆಂಟೇಜ್, ಮೇ ಬಿ ಡಿಫರೆಂಟ್. ಮೇ ಬಿ 1%, 2%, ಮೇ ಬಿ 10%, ಮೇ ಬಿ 20%. ಸ್ವಲ್ಪ ಹೆಚ್ಚು ಪರ್ಸೆಂಟ್ ಇದ್ದಂಗೆ ಅವನು ದೆನ್ ಹಿ ಗೋಸ್ ಟುವರ್ಡ್ಸ್ ಮೆಂಟಲ್ ಇಲ್ನೆಸ್. ಬಟ್ ಅದರ್ವೈಸ್ everyone is having one or the other way mental problem ಅಂತ ನನ್ನ ಅನಿಸಿಕೆ. ತಮ್ಮ ಅಭಿಪ್ರಾಯ ಏನದಕ್ಕೆ?
Mental health problem is a continuum. Like you told it very clearly. Like all of us have. I mean, we all feel sad. We all feel happy. Sometimes you feel tired. You don't feel like doing anything. But again, it's very normal. It becomes a problem when it becomes a problem. That is, it becomes a problem when you can't function, when it affects your occupation function or relationships or your behavior. Then only it becomes a problem. I mean, feeling low, feeling happy, feeling sad, crying, we all do that. We all get anxious. We all get angry. That's very normal. Only it becomes a problem if it becomes a problem. That is, when it affects your functioning, then only it becomes a problem. It's a continuum. Exactly what you said.
Oh, thank you. ಮತ್ತೊಂದು ಕ್ವಶನ್, ಈ ಮೆಂಟಲ್ ಹೆಲ್ತ್ is it related to somewhat dementia also?
No. Illa, sir. That's totally different. Totally different, sir.
Okay.
Dementia.
Common factor ಇದೆ ಅದರಲ್ಲಿ between these two?
Yes,
some basic
dementia is because of your death of your brain cells for various reasons. It can be because of stroke or somebody called Alzheimer's disease, or because of the brain tumor and all that. So it is death of brain cells. Whereas in mental health problems, it doesn't happen like that.
Okay, thank you.
And, yep.
Continuation with my first question, Dr. Rajendra. ಹೌದು, ಹೆಂಗೆ ನಾವು ಐಡೆಂಟಿಫೈ ಮಾಡ್ಬೇಕು? ಸೆಲ್ಫ್ ಐಡೆಂಟಿಫಿಕೇಶನ್ ಈಸ್ ಕ್ವೈಟ್ ಡಿಫಿಕಲ್ಟ್ ಬಿಕಾಸ್ human nature is that I don't want to be accepting myself that I am under depression. And if other person identifies that, okay, you are having an issue, just go and consult with the doctor, then again the egoism comes in. So how do you
I mean, that's a very common problem. Like that's what they say, because you know that New Zealand has got highest number of suicide among the OECD countries. What they say the reason is we don't talk. Even if we identify the problem, like suppose if I identify a problem in my family member, I don't go and tell them that you have got a problem, you should go take treatment. What they say is once you start talking, things get better. There are various things you can do. Like, I mean, one is suppose if you are concerned about somebody who's depressed, who needs treatment, you can yourself call the mental health services and ask for help. Usually in New Zealand, they'll come and provide that help. Like they'll come and see that patient, and depending upon how bad is the patient, they'll give various pathways for the treatment. Like somebody even can be admitted to hospital against their will. So I think it is best is what we always say is go and talk to that person one-to-one. Sometimes most people accept, but again, there are chances that people don't accept. When they don't accept and you are really concerned about somebody's depression, then it's a good idea to call the mental health helpline and they help.
Thank you. Other people, please feel free to clarify if you got any doubts or any issues. Don't feel shy, or people might think something.
I will email you some resources, including there are a lot of now apps on the phone, like for both Android and iPhone. There are a lot of apps. Like one the best is called Calm, CALM. It's really good in terms of mental health. I will email you to either Dr. Kalburgi or Lina Kalburgi, so you can share that with others.
So we're going to share this recorded session to our wider communities, because many people, because of the cricket today, so they couldn't attend.
I just checked the score also.
Did you?
Namaste, auntie. Sorry. Just Shailaja. Nan Shailaja anta auntie.
Hi Shailaja.
ಹೇಗಿದ್ದೀರಾ ಆಂಟಿ?
ಚೆನ್ನಾಗಿದ್ದೀನಮ್ಮ, ನೀನ್ ಹೇಗಿದ್ಯಾ? ಮಕ್ಕಳೇಗಿದ್ದಾರೆ?
ಹಾ ಆಂಟಿ ಚೆನ್ನಾಗಿದ್ದಾರೆ. ಸಾರಿ ಆಂಟಿ, ನಾನು ಜಸ್ಟ್ ಒಂದು ಕ್ವಿಕ್ ಕ್ವಶನ್ ಕೇಳ್ಬೇಕು ಅಂದೆ. ಏನಂದ್ರೆ ಈ ಜಸ್ಟ್ ಲೈಕ್ ಈ ತರ ಸ್ವಲ್ಪ ಅಪ್ಸೆಟ್ ಆಗೋದು, ಮತ್ತೆ ಮಕ್ಕಳಲ್ಲಿ ಡಿಪ್ರೆಷನ್ ಸಹಿತ ಕಾಡ್ತಿದೆ. ವೈ ಆಂಟಿ? ಫಾರ್ಮ್ ಅಂದ್ರೆ ದೊಡ್ಡವ್ರಿಗೆ ಐ ಕ್ಯಾನ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್, ಬಟ್ ಮಕ್ಕಳಲ್ಲಿ ಯಾಕೆ ಅಂತ ಜಸ್ಟ್.
ಮಕ್ಕಳಲ್ಲಿ ಯಾವ ತರ ಸಿಂಪ್ಟಮ್ಸ್ ಇದೆಮ್ಮ ಶೈಲಜಾ?
ಅಂದ್ರೆ ಲೈಕ್ ಅವರು ನಿದ್ದೆ ಮಾಡಲ್ಲ, ಮತ್ತೆ ಕೆಲವೊಂದ್ಸಲ ಅವ್ರಿಗೆ ಬೇಕಾಗಿರೋದು ಏನಾದ್ರು ಅಂದ್ರೆ ಇನ್ನ ಸಿಲೆಬಸ್ ಅಲ್ಲೇ ಇರ್ಬೋದು ಅಥವಾ ಆ ತರದ್ರಲ್ಲಿ ಅವ್ರಿಗೆ ಸಣ್ಣ ಸಣ್ಣ ಪ್ರಾಬ್ಲಮ್ಸ್ ನ ಸಾಲ್ವ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗ್ಲಿಲ್ಲ ಅಂದ್ರೂ ಒಂಥರ ಆನ್ಸೈಟಿಗೆ ಒಳಗಾಗೋದು. ಆಮೇಲೆ ಅಂಡ್ ದೇ ವಿಲ್ ಗೆಟ್ ಈಸಿಲಿ ಗೆಟ್ ಡಿಪ್ರೆಸ್ಡ್. ನಾವು ಇಟ್ಸ್ ಓಕೆ, ವಿ ಕ್ಯಾನ್ ಟೇಕ್ ಇಟ್ ಇನ್ ನೆಕ್ಸ್ಟ್ ಸ್ಟೆಪ್ ಅಂತ ಅನ್ಕೊಂತೀವಿ. ಸಾರಿ ಆಂಟಿ, ಶಿ ಇಸ್ ನಾಟ್ ಕೀಪ್.
ಎಷ್ಟು ವರ್ಷ ಅಮ್ಮ ನಿನ್ ಮಗಳಿಗೆ?
ಇಲ್ಲ, ಶಿ ಇಸ್ ಓಕೆ ಆಂಟಿ. ಜಸ್ಟ್ ನಾನ್ ಬೇರೆ ಅಂದ್ರೆ ಮಕ್ಕಳಲ್ಲಿ ನೋಡ್ತಾ ಇರ್ತೀನಲ್ಲ, ಹಾ ಆಂಟಿ, ಇಟ್ಸ್ ನಾಟ್ ನನ್ ಮಕ್ಕಳಿಗೆ ಅಂತ ಅಲ್ಲ, ಇಟ್ಸ್ ಕ್ವೈಟ್ ಕಾಮನ್
So
ಕ್ವಶನ್
maybe,
ಅಷ್ಟೇ. ಅಂದ್ರೆ
but it may not be
ನನ್ನ work
depression
ನೋಡ್ತಾ
related,
ಇದ್ದೀನಿ.
but it might be hata antivalla.
Yeah, at that age, I mean, very young age, it can be lot of other reasons. I mean, it can be the spectrum of normal reactions. I hope Dr. Rajendra will agree. Hata madadu, tantrums, so behavioral issues. So depression is not a diagnosis we gave in such kids only. Gottaita? That so mainly it can be a behavioral issue. So I think first of all you should go to your GP and address your concerns. There are a lot of support systems nowadays, parental support, so they can refer you to these places. I think there's a lot available for that. You go and go to your GP first. And then where do you go as your GP? I'm not asking where, because our local doctors, we have got a lot of support. So I'm asking, are you with the local doctors or others, Santa?
ಲೋಕಲ್ ಡಾಕ್ಟರ್ಸ್ ಆಂಟಿ ನಾನು ಈ ಕ್ವಶನ್ ಕೇಳಲಿಕ್ಕೆ ಕಾರಣ ಅಂದ್ರೆ ಬಿಕಾಸ್ ಆಸ್ ನಿಮ್ಗೆ ಹೇಳಿದೆ ನಾನು ಒಂದು ಸ್ಪೆಷಲ್ ಸ್ಕೂಲ್ ಅಲ್ಲಿ ಹೋಗ್ತಾ ಇದ್ದೀನಿ ಟೀಚರ್ ಇಡಕ್ಕೆ. ಹಾ, ಸೊ ಐ ಸಾ ದಟ್ ಪೀಪಲ್ ಬಿಕಾಸ್ ಅಂದ್ರೆ ಮಕ್ಕಳು ದೇ ಆರ್ ವೆರಿ ಗುಡ್ ಅಟ್ ದ ಸಿಲೆಬಸ್ ಅಂಡ್ ಬಟ್ ಅವ್ರಿಗೆ ಒಂದೇ ಪ್ರಾಬ್ಲಮ್ ಏನಂದ್ರೆ ಮೆಲ್ ಡೌನ್, ಬೇಗ ಮೆಲ್ ಡೌನ್ ಆಗ್ತಾರೆ. ಆಮೇಲೆ ಇಫ್ ದ ವರ್ಕ್ ದೇ ಆರ್ ಡೂಯಿಂಗ್ ಇಟ್ಸ್ ನಾಟ್ ಪರ್ಫೆಕ್ಟ್ ಅನ್ನೋದು ಬೇಗ ಆಂಗ್ಸೈಟಿ ಒಳಗಾಗ್ತಾರೆ. ದೇ ವಿಲ್
teach with children with special needs,
ಹಾ
at your regular school. I think that's the reason. So they are in a different world, Grata. So they should be looked after by a specialized people. ಅವ್ರಿಗೇನೆ ಇದಿರುತ್ತೆ, mental health team ಇರುತ್ತೆ, ಗೊತ್ತಾಯ್ತಾ? So if these are all, they will be more sensitive. They can do all these things. If they are special needs children, they should get help about, what's happening, or is it their normal behavior expected for their condition? So it is difficult to say exactly with kids what's happening, Anta.
Okay.
So
ಥ್ಯಾಂಕ್ ಯು ಆಂಟಿ. ನನ್ಗೆ ಆಂಟಿ ಫಸ್ಟ್ ಟೈಮ್ ನಾನು ಅಂದ್ರೆ ಆತರ ಮಕ್ಕಳ ಜೊತೆ
ರಾಜೇಂದ್ರ ಅವರೇ.
No, exactly what you said is correct. Like, I mean, there can be hundreds of reasons why the child is not doing well, and especially Shailaja, if you're teaching at a special needs, I think there may be other many reasons. It can be because of autism, it can be because of attention deficit disorder, it can be because of oppositional disorder. There are so many reasons, and unless you see a particular child, you can't really tell what the exact reason why that child has a problem.
Okay, thank you.
No
because I'm working with the autism kids only, because some of them they are really, I know, but because you told about yoga and all, so I thought if I get any tips, then we can implement it. That's it. Thank you.
It's a good question, Shailaja. So implementing is always learning with your professional side by side. It's always good to know extra things so that you can help them.
Shailaja, if you are interested, you read called Applied Behavior Analysis. This is quite good for children with autism. I can send you some information through Dr. Kalburgi.
Thank you so much, Uncle. Because only ನಾನು ಒಂದೇ ಒಂದು ಟಿಪ್ಸ್ ಯಾರಿಗ್ ಕ್ವಶನ್ ಕೇಳ್ಬೇಕು ಅಂತ ನಂಗೆ ಅರ್ಥ ಆಗ್ಲಿಲ್ಲ. ಜಸ್ಟ್ ನಾನು ಏನ್ ಅಪ್ಲೈ ಜಸ್ಟ್ ನಿಮ್ಗೆ ಕೇಳ್ತಾ ಇದ್ದೀನಿ. ಬಿಕಾಸ್ when we observed ಒಂದು ಮಗು ಇದೆ, ಆ ಮಗು ಯಾವಾಗ್ಲೂ ಅದ್ರ ಬಟ್ಟೆ ಜೊತೆ ಆಟ ಆಡ್ತಾ ಇರುತ್ತೆ. ಅಂದ್ರೆ ಅದಕ್ಕೆ ಏನೋ ಒಂದ್ ಸ್ವಲ್ಪ ಉದ್ವೇಗಕ್ಕೆ ಒಳಗಾಗಿದ್ರು ಅದು ತನ್ನ ಬಟ್ಟೆಯಿಂದ ಕೈ ಬೆರಳಿಂದ ಸುತ್ಕೊಳ್ಳೋದು ಈ ತರ ಮಾಡ್ತಾ ಇತ್ತು. ಒಂದು 3-4 ವಾರದಿಂದ ಕಂಟಿನ್ಯೂಸ್ ಅಬ್ಸರ್ವ್ ಮಾಡ್ತಾ ಇದ್ವಿ. ಸೊ ನಾನೇನ್ ಮಾಡ್ದೆ, ಟ್ರೈ ಮಾಡೋಣ ಅಂತ ಆ ಮಗುಗೆ ಬಟ್ಟೆಯಲ್ಲಿ ಕೈ ಹಾಕ್ಬೇಡ ಅಂತ ಹೇಳಿ ತನ್ನ ಎರಡೂ ಕೈಗಳನ್ನ ಜೋಡಿಸ್ಕೊಂಡು ಕೂತ್ಕೋ. ವೆನೆವರ್ ಈ ಒಂದ್ ಸರ್ಕಲ್ ಟೈಮ್ ಅಂತ ಮಾಡ್ತೀವಿ, ಆ ಟೈಮಲ್ಲಿ ಆತರ ಮಾಡಿದ್ವಿ. ಇದು ಕರೆಕ್ಟಾ ತಪ್ಪ ಗೊತ್ತಾಗ್ಲಿಲ್ಲ, ಬಟ್ ಅದು ಸ್ವಲ್ಪ ವರ್ಕ್ ಆಯ್ತು. ಬಟ್ ಅದೇನಾದ್ರು ಮುಂದೆ ಏನಾದ್ರು ಪ್ರಾಬ್ಲಮ್ ಆಗತ್ತಾ ಅಂತ.
Yeah, that is the same thing what is called the applied behavior analysis. I mean, there is nothing right or wrong. I mean, these are the techniques. These are the techniques which help a child with autism. I will send you some information. Have a read.
Yeah, thank you so much, Uncle.
Not
And
a
the
problem.
session was really good and it helped me a lot. Thank you.
Thank you. Thank you.
ಆಮೇಲೆ ಒಂದು ಕ್ವಶನ್ ಅಂದ್ರೆ, ಈಗ ಇದು ADHD ಅಂತ ಈಗೊಂದು ಸಿಗ್ಮಾ ಈಗ ಬರ್ತಾ ಇದೆ ಅಲ್ಲ, ಈಗ ಲಾಟ್ ಆಫ್ ಚಿಲ್ಡ್ರನ್ ಆರ್ ಫೇಸಿಂಗ್. ಅದು ಇಲ್ಲಿ, because I'm noticing it's common, because child will know exactly that okay, parents are not supposed to force them for anything, for any reason. Immediately they start demanding so many things. Is there any reason why it happens? Any parental advice you would like to give it to those kids?
No. ADHD is nothing to do with the parents' behavior. I mean, it is mainly because of the damage in the brain. So,
Okay.
Actually, I mean, I see the Caucasian parents are better than our parents. They manage children quite well. Our parents don't manage children quite well.
So ಈ cultural exchange ನಲ್ಲಿ, because now because our kids are born here and then we carry our own culture. So how do we have to manage that difference or the gap?
No, I think we should give them the liberty. I mean, what you have done to Lokesh, I mean, that's the best example. I mean, you and Dr. Kalburgis, you are a very ideal example. Like I think you give them the liberty. Like I think you need to understand, especially with the other children problems. Like when their children suffer. I mean, because when they go out, they have to behave in a particular way. When they come home, they behave in a particular way. As long as they don't, many people ask me this. I say that as long as they don't use drugs, allow them to do what they want to be. Yeah. Because we need to give them the freedom. Like it doesn't, like when we come here, we need to accept the way of life here, and we need to give them the freedom.
That is the issue with our generation, because accepting as it is difficult, because every time we apply that because of you we came here. So that is something, I don't know whether it is right or wrong.
No, you came because of you, not because of them.
But back of our mind, it is we came just for the children education and for the children career.
But again, they would be very happy if you had stayed back wherever you are, isn't it?
Thank you.
Sir, ನಂದೊಂದು ಕ್ವಶನ್ ಇತ್ತು. Like nowadays, ಸೋಷಿಯಲ್ ಮೀಡಿಯಾ ಅಥವಾ ನ್ಯೂಸ್ ಚಾನೆಲ್ಸ್ ಅಂಡ್ ದೆನ್ ಸ್ಟಡಿ ರಿಪೋರ್ಟ್ಸ್ ಅಂತ ತುಂಬಾ ಬರ್ತಾ ಇರುತ್ತೆ ಮೀಡಿಯಾದಲ್ಲಿ, ಅಥವಾ ಲೈಕ್ ದೇ ವಿಲ್ ಪ್ರೆಡಿಕ್ಟ್ ಸಮ್ ಫೈನಾನ್ಷಿಯಲ್ ಇದು ಬ್ಯಾಂಕಿಂಗ್ ಎಲ್ಲ ಏನಾಗುತ್ತೆ ಅಥವಾ ಜಾಬ್ ಮಾರ್ಕೆಟ್ ಏನಾಗುತ್ತೆ. ತುಂಬಾ ಲೈಕ್ ದೇರ್ ವಿಲ್ ಬಿ ಸೋ ಮಚ್ ಆಫ್ ಇನ್ಫ್ಲುಯೆನ್ಸ್ ಆಫ್ ನ್ಯೂಸ್ ಚಾನೆಲ್ಸ್ ಅಂಡ್ ದೆನ್ ಮೀಡಿಯಾ, ಸೋಷಿಯಲ್ ಮೀಡಿಯಾ. Like how much that influence to our anxiety or our mental health?
A lot. Too much. I mean, people, there's very jokingly people called WhatsApp University. There's so many information. There's so many myths, misinformation, and all that. I mean, many people believe it. Unfortunately, I think it causes a lot of anxiety for many people.
So media, social media ginta like sometime in the newspaper, news channel, they study ಸೆಷನ್ಸ್ ಅರೇಂಜ್ ಮಾಡ್ತಾರೆ, ಮತ್ತೆ ಸ್ಟಡಿ ರಿಪೋರ್ಟ್ ಗಳನ್ನ ಕಳಿಸ್ತಾರೆ, ಮತ್ತೆ ಸೋ ಮಚ್ ಆಫ್ ಬೇರೆ ಬೇರೆ ಪ್ರೆಡಿಕ್ಷನ್ಸ್ ಗಳನ್ನ ಕಳಿಸ್ತಾ ಇರ್ತಾರೆ. ಲೈಕ್
it does affect the mental health. It does affect the depression. I mean, you feel sad like when you hear that economy is not going to get better, or there will be a lot of job loss or increase in the house prices. I mean, these things do affect, everybody.
Like how to control ourselves in that situation? Like, do you need to completely turn off those media channels, or like?
No, I mean you can't, isn't it? I mean, you need to know. You need to know what's happening in the world. I mean, you need to be informed. But again, I think you make your own decisions. You make your own. You make your own conclusions by reading and doing things. And again, if it happens, it will happen. You can't change it. There are certain things in the world we can change, and certain things we can't. In the world we can't change. I think the best would be to accept things we can change and accept things we can't change. So I mean that will help you. Suppose if because Ukraine war, we can't do anything because of that. Petrol prices have gone up. There is no point in me worrying about petrol prices has gone up because I can't do anything about the war in Ukraine. So that's how you cope with things.
Dr. Rajendra, can I ask a question on acceptance?
Yep.
It's easy. First, I'm Mahananda Galgali. Leena and Kalburgi uncle know me. Like we know through Manoj Dalli. So I've been in New Zealand since last 5 years. So regarding acceptance, I don't know, it's a problem with me. It's hard to accept. I mean, like there are so many things which we know at some level we can't change.
Yep.
But it's the habit of mind to react somehow at some level.
Yep.
And I don't know, is there any tips or anything which we can do to change this behavior of blind reactions?
I mean, I think what they say, the practice makes you perfect. Like I think it is keep on, as soon as you became aware that, I mean, you are reacting in a negative way, I think that is the time you stop. And I think once you being aware of it is a really good thing. So I think you have to keep on practicing. And actually, there is one of the best book to read. It's called, there are green books. It's called, I think, a book for dummies. It's called Cognitive Behavior Therapy for Dummies. It's really a good book which talks about acceptance.
Okay.
You get that in the council library also, or you can buy it in the Whitcoulls. So that's quite a good book. How you practice, how you change your thinking and how you react to a situation and how to change that.
And the other question was, we have so many stresses, and these days it is considered it's normal, but it's not. You know what I mean? That
See, stress for you may not be a stress for me, or stress for me may not be a stress for you. Stresses are different. I don't think anybody considers stress as being normal. Certain stresses are like, it is not called normal. It is called like universal. Like, for example, COVID and lockdown is a universal stress for everybody. It is not only for you. But any stress you feel that is something which is affecting you, like a pain in your finger is stressful. It can be stressful for you, but it may not be stressful for me. Like, so each stress is different for a different person, and it also for the same person, stress can be different in a different situations. So when you stress is best is, as I said before, like is talk to people, meditation, exercise, and trying to resolve the stress will help you.
But how do we find the time? I mean, like, I am complaining that I have a baby and I work full time. I have an exam coming up. I have household chores. And even though it's like work from home, it's just saving my traveling time. Nothing else is saved. So how do we incorporate, like, what can I do normally, what I do, but in a better way?
Make your husband to do half the work.
He does, but then he does. But you know, like taking care of the baby becomes my job. Like,
No, no,
yeah,
it should be equal.
and
It should be equal job. I asked my wife. I fed my daughter for 3 months at night because of which she was bottle fed. So it is not his job. Your job. It's his. So
no, I mean,
see,
like,
like
he's
I know it's what you're telling is really a practical. It's a practical problem, but again, it's very important to have a time for yourself. That is very important. At least half an hour a day, or like half a day a week, like in a weekend, where you can just go out, meet some of your friends, leave the baby and your husband at home. You go out. I mean, that's very important.
He's not
That will
hearing.
help you.
I mean, it's. I'll just interfere. This takes only few minutes in a day for you to set aside. Like sometimes they say even 5 minutes of every day. Taking time for yourself and doing some breathing exercises helps with your anxiety and stresses. I mean, what the Dr. John was telling was, though we are aged digitally so fast, our brain training is still in the Stone Age, he says. That means training our brain is very important. By regular practices like mindfulness, meditation, breathing. So breathing is so important. They say in deep breathing, it goes to what we call a wave in the brain called delta waves, which we get only in deep sleep. So much relaxation you get. If you do it regularly, it doesn't come in a day or two, regularly for a few months, then you will notice the changes in your life. Yeah.
Dr. Nanda, thank you for joining today. And
thank you, Uncle, for inviting.
I could, continue Dr. Rajendra's suggestion, half an hour a day, take time and go out. So I can add another thing that once a month, we will have Mahamani program. It's set.
Sure.
So you attend that program, I think your half of the problems will be solved. And try once
Okay,
and
Uncle, I'll
no.
try. I'll leave you one with you and then I'll go out.
Yeah, you can do that. Always
Yeah,
welcome.
I'll leave you. Yeah, thank you so much.
Okay.
Hey.
Any more questions?
Another question is that Dr. Usha ಅವ್ರಿಗೆ another question like finding purpose in life ಅಂತ ಹೇಳಿದ್ರಲ್ಲ, like what we observe here is in India mainly ಏನಾಗುತ್ತೆ, ಸ್ವಲ್ಪ ಏಜ್ ಆಗ್ತಾ ಸ್ವಲ್ಪ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ ಅಥವಾ ಏನಾದ್ರು ಹೆಲ್ತ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಬಂದ್ರೆ ಲೈಕ್ ದೇ ಲೂಸ್ ಪರ್ಪಸ್ ಇನ್ ಲೈಫ್, ಲೈಕ್ ಲೆಟ್ಸ್ ಹೆಂಗೋ ಒಂದ್ ಆಗುತ್ತೆ, ಏನೋ ಒಂದ್ ಮಾಡ್ಕೊಂಡು ಇರೋಣ, ಆತರ ಒಂದಷ್ಟು ಟಾಕ್ಸ್ ಬರುತ್ತೆ. ಲೈಕ್ ಸೊ ಆ ಏಜ್ ಸ್ವಲ್ಪ ಒಂದು ಏಜ್ ಆಗಿರೋ ಜನರೇಷನ್ ಅಲ್ಲಿ ಲೈಕ್ ಹೌ ವಿ ಕ್ಯಾನ್ ಫಿಲ್ ದ ಪರ್ಪಸ್ ಇನ್ ಲೈಫ್ ನ ಹೇಗೆ ಅವ್ರಿಗೆ ಮೋಟಿವೇಟ್.
So that's what they were telling. So one thing is, let them do what they like to do, like simple things, just going out in a bright day, or if they like to read
I think ಇಲ್ಲಿ ನೀವು ಓಲ್ಡ್ ಪೀಪಲ್ ನೋಡಿದ್ರೆ ಲೈಕ್ ಗೋಯಿಂಗ್ ಔಟ್ ಅನ್ನೋದು ಇಸ್ ಲೈಕ್ ನಾಟ್ ಎ ಗೋಯಿಂಗ್ ಔಟ್ ಮೀನ್ಸ್ ಲೈಕ್ ಗೋಯಿಂಗ್ ಟು ಎ ಫಂಕ್ಷನ್ ತರ ಇರುತ್ತೆ. ಅಂದ್ರೆ ಐದರ್ ಯಾರ್ದಾರು ಫಂಕ್ಷನ್ ಇರುತ್ತೆ, ಇಲ್ಲ ಮ್ಯಾರೇಜ್ ಇರುತ್ತೆ, ಅದರ್ಸ್ ಕಾಲ್ಡ್ ಗೋಯಿಂಗ್ ಔಟ್, ಅಥವಾ ಟೆಂಪಲ್ ಹೋಗೋದು ಗೋಯಿಂಗ್ ಔಟ್ ತರ ಇರುತ್ತೆ. ಇಟ್ಸ್ ನಾಟ್ ಲೈಕ್ ರೆಗ್ಯುಲರ್ ಗೋಯಿಂಗ್.
Well, what would they like to do? Ask them first, what would they like to do? That's important. Like sometimes it's gardening or reading a book or spending time with grandchildren. So any pleasurable activities to them, it should give them a purpose, or doing a voluntary job sometimes, So age is not a criteria for, not doing. So they have to engage in some pleasurable activities, and also doing the mindfulness practice of breathing, meditation, that increases the positive input to the brain. They have seen that the compassion treatment and mindfulness practices on the MRI scan, it strengthens the positive emotion wiring in the brain. So they should have some purpose in life to do that. We want to do this, so they have to do that. Yeah, they like cooking, let them cook. Sometimes in India, if you get old, like, okay, you're old, you don't want to do it, I'll do it, So, but if they enjoy something, let them do it. Pleasurable activities, breathing exercises, so all these things, yeah. But they should enjoy that.
Okay, yeah. Thank you.
Purpose of life is very important for everybody, whatever it is. Yeah.
Okay, I think we all, the whoever is attendees, they had a good, insightful, and also the information what both of you have shared is really useful for us. And as a Baso Samiti, we have got some kind of help from Ministry of Social Development and Ethnic Communities. So we would like to have these kind of series moving forward. So we would appreciate your participation and your guidance for the Baso Samiti. And also because we know both of you like family members is not only professional, but we enjoy your company always. And we would like to thank you for coming with coming on today's session with your busy schedule, especially Rajendra. ನೀವು 7 days a week ನೀವು ಕೆಲಸ ಮಾಡ್ತೀರಾ. ಆಮೇಲೆ ಉಷಾ being in US with her daughter and kid grandchildren, she spared her personal time to join with us and then giving very good information for us. We thank you both of you. And also, because we know how we faced especially the cultural issue when we came to New Zealand. And also I think we are kind of successful in coming out of these cocoons, of our own cocoons. And then when you see our kids and then they're really shining up, and then we should be